Welcome back. When your little one is going through potty training, many parents can expect a lot of accidents to happen. But at what point should you seek professional help? That's what we asked the professionals at Kids in Motion. Here's their advice. Here we are with Ariana from Kids in Motion in Mandan. Thank you so much for having us here today.
Good to be here.
Okay, we are both, as we mentioned, moms of little ones, young ones right now. And so a topic that is very important is what's going on in the bathroom with those little ones. And something that's very important that parents might realize at a certain point is talking about constipation. So talk to us about what is that and what should they be looking for?
Well, as a mom, I think one of my first questions was always how many times should my child be going and voiding throughout the day? But it really doesn't have as much to do with the amount of times they're going, but rather the quality of the movement itself. Are they straining on the toilet? Are they having 1 to 2 bowel movements a week? That might mean that they are constipated and we maybe need to teach how to properly void our bowels. Or are we going multiple times a day, but we have loose runny stool? So it might be a dietary change that we might need to address with the child. So as a mom, if you're struggling with potty training, especially when it comes to the constipation, the painful parts of going, it might actually kind of go into when kids don't want to sit on the toilet.
So you mentioned some of the sensory training that you do here with your therapy. Can you go a little more into that and what a parent could expect if this is something that they sign up for?
So the sensory approach that we take with occupational therapy, sometimes when kids have painful bowel movements, they stop wanting to go to the bathroom as frequently, and it actually reduces the sensation in their bowels. So pretty soon they won't have the sensation because their bowels are so distended that they're just storing and storing and storing. And so what we do is not only can we teach correct posturing and how to do like a big belly breath and a hard belly breath so that we're not straining as much and we're breathing while we're going, but we can also do manual therapy. So we can actually go over the skin and we can do what's called an ILU massage. We can also use skin rolling over the abdomen to ease those blockages and help have more consistent bowel movements, which then helps the body recognize this is the way that my body needs to feel, and we can re-educate that system using a sensory approach, but also using a tactile approach where the therapist touches and rubs the belly.
Mike is a physical therapist at Kids in Motion, and we are going to talk a little bit about the warning signs that parents should maybe be on the lookout for when dealing with issues with bladder or bowel. What can you tell us about that?
Yeah, so some of the warning signs with constipation in general, hard lumpy stools, if we're looking for excess straining, abdominal pain when they're going to the bathroom, decreased appetite, something parents don't usually look out for, but if your kid's not eating too much, sometimes it can be because they're all backed up. Some other things to look out for, streaks in the underwear. If you start noticing that, it can be a big indication for constipation. When we get backed up with stool, a lot of the times we can decrease the sensation around our going to the bathroom. And it can kind of cause leakage into our underwear. So,
what would you like parents to know about potty training, and especially the difference between night training and day training?
Potty training, there's a big stigma that your kid needs to be potty trained by 2. And everybody tries to rush their kid to be potty trained, but most kids don't get fully potty trained until 4 or 5. So we kind of need to slow down a little bit and make sure that these kids, we see the signs that they're ready. So we want our kids to recognize that they have to go to the bathroom. Most of the time they need to be able to dress and undress before they're completely ready to use the restroom. If they're hiding in the corner to go to the bathroom in their pull-up, that's a big sign that they're ready to go potty training. All of these things you have to be able to recognize in your kid before you start rushing them to potty train. And if we rush them too quickly, they can kind of regress.
Some great advice right there from Kids in Motion. And we do want to mention, if you have questions, make sure you call 701-415-0000. Kids in Motion in Mandan. They have some great tips right there for